Cancer diagnoses could rise 77% by 2050.
Cancer is something most of us in the Western world are familiar with. Many of us have family members or friends who either underwent or are currently undergoing cancer treatment, especially in Canada, where it's the leading cause of death. Now, what some of you may not be familiar with is that cancer is not a singular disease. It is in fact a group of diseases that are very diverse. For example, breast cancer is very different from brain cancer, and that is what makes diagnosing and treating cancers so difficult. Now, if you catch cancers at an earlier stage, they're easier to treat. However, over 50% of cancers are caught at an advanced stage when they are very aggressive. At this stage, physicians have to use more harsher and aggressive methods to treat and manage the disease. In the relentless fight against cancer, a groundbreaking new approach promising to redefine early cancer detection and monitoring is emerging, a technology called liquid biopsies. Imagine if a simple vial of blood could tell doctors everything they need to know about your cancer. That's right, no surgeries, no invasive biopsies, just a vial of blood. Sounds futuristic, right? But it's happening right now.
Now, a new blood test is raising hopes of detecting many types of cancer long before symptoms appear. Cancer kills around 10 million people worldwide each year. Some types are hard to detect until the advanced stages when treatment options are then limited.
But before we get into liquid biopsies and the new technology that is advancing it further, let's take a few steps back and understand how cancer is being diagnosed currently, and why it is so difficult to catch cancers early. Now, as we said previously, there is no one-size-fits-all approach to detecting cancer, which is partly what makes it so difficult to diagnose early. However, it generally involves some sort of imaging followed by a biopsy if the imaging results showed some concern. So, what does that even mean? Well, if you go to your physician with the symptoms of cancer, they would first order an imaging scan. This could be an MRI, a CT scan, an X-ray, an ultrasound, or something else. The purpose of these scans is to find cancerous or tumorous masses in the suspected organ. Now, these tumorous and cancerous masses look different than your normal organs because of the changes that these cells undergo to become cancerous. However, sometimes these masses are so small that they are difficult to discern, and they can be missed. Other times, they're very large and the cancer has already grown to an advanced stage, making treatment more difficult. If the physicians do see suspected cancer cells on the imaging results, they move on to perform something called a biopsy. Because we cannot just go around prescribing cancer medications to patients we're not sure have cancer. So, what is a biopsy, you may ask? Well, a biopsy is just a physician taking a small mass of the cancerous region and performing tests on it to confirm whether or not it is actually cancer. Now, these biopsies are very invasive, requiring surgical intervention, as the physician needs to go in and actually pick a piece out. Furthermore, these biopsies need to be done at specialized healthcare centers, so patients who live in rural areas, they may need to miss multiple days of work and also travel hours and hours to get to a hospital that can perform biopsies. And that's why liquid biopsies hold so much promise. Gone will be the days where you have to travel miles and miles away to a specialized healthcare center to get a biopsy. Gone will be the days where you have to sit in a hospital bed for post-operation care following your biopsy. And gone will be the days where you have to wait for your serious symptoms to survive before you can get tested for cancer. A simple blood test will be all that's needed for you to get diagnosed for cancer.
So, what exactly is a liquid biopsy? Simply put, it is a blood test. Why is a blood test so revolutionary? Well, when cells die, they release tiny fragments of their DNA into the bloodstream. DNA is a blueprint for all your cells, and cancer cells have errors in this blueprint, which turns them cancerous. These tiny fragments of DNA are known as cell-free DNA, or cfDNA. Now, cancer cells also die, and they also release tiny fragments of their DNA into the bloodstream. We call this DNA circulating tumor DNA, or ctDNA. Using a technology called DNA sequencing, physicians can read the fragments of DNA present in the bloodstream, almost like a code. We know what the DNA code for healthy cells looks like, and anyone, including you, can take a look at it. When we sequence these fragments of DNA, we match them to the correct location that we expect it to be from, and then check if there are any errors in the DNA that do not match. If there are errors, do we believe them to be cancer-causing? Physicians can detect these flags to know if there is a likelihood of tumor being present somewhere in the body, and can potentially act earlier to find it, and start treatment earlier.
So, what are are the benefits of using liquid biopsies with circulating tumor DNA? While there are many, here's 4 key ones that we want to focus on. Starting with number 1, earlier cancer detection. Liquid biopsies allow us to detect cancer earlier, before symptoms may even appear. And as we said previously, earlier cancer detection means earlier treatment, and earlier treatment is associated with better outcomes in cancer treatment, which is amazing. Number 2 is disease monitoring. While the patient is undergoing treatment, we can continue to monitor the ctDNA levels in their blood. If the ctDNA levels are decreasing, that's good. That means the cancer is dying and the treatment is working. However, if the ctDNA levels are staying the same or increasing, a change in treatment might be necessary. Number 3, precision medicine. With liquid biopsies, we can detect exactly what errors are in the cancer cells, and we can use drugs that target these specific errors. That way, we have precision medicine for each unique cancer profile, for each unique cancer patient. And finally, overcoming geographical barriers. With regular biopsies, patients often have to travel miles and miles away to specialized centers to get biopsies done. However, blood tests are easier to perform and can be done anywhere. So instead, we can take a blood test of a patient in a rural area and then ship that blood over to a specialized center instead. So with these 4 benefits, liquid biopsies provide a faster, safer, and more efficient way to detect cancer and monitor cancer outcomes. Another interesting application of liquid biopsies is minimal residual disease monitoring, also known as MRD. Now, oftentimes, when we are treating cancer, there are some cancer cells that manage to survive. Over time, these cancer cells can continue to grow and proliferate and turn into cancer masses again. That is something known as cancer recurrence or relapse. With liquid biopsies, we can continue to monitor patients' blood after treatment to make sure that the ctDNA levels don't rise again. If they do, we can get them back on treatment. Yes, you heard me correctly. With liquid biopsies, we may even be able to stop cancer relapses before they even happen. And this may soon be possible thanks to this amazing new research. So, where are we with liquid biopsies right now? Well, they're most common in use in lung, breast, and colon cancer, but research is underway to expand their use in every single type of cancer. Another interesting area of research is to use liquid biopsies to monitor patients who have cancer in their family history. These patients are more likely to develop hereditary cancer syndrome. And what that means is that because they have cancer in their family history, they're more likely to develop cancer. With liquid biopsies, we can continue to monitor ctDNA levels in their blood, and if there is a detection, we can start treatment earlier. And again, as we said previously, earlier treatment has better treatment outcomes. Now, undeniably impressive benefits aside, there are still some significant challenges before liquid biopsies can come to the masses. The first being, it is significantly expensive to transport these blood samples from the rural areas to the specialized healthcare centers. And number 2, it requires a significant buy-in from both patients and physicians. It is important to note that the benefits of liquid biopsy is not to replace current surveillance method, but used as an adjunct surveillance method to improve healthcare outcomes for these patients.
So, let's recap all that we've learned today about liquid biopsies. Liquid biopsies are revolutionizing cancer detection and monitoring by using a simple blood test to analyze tumor DNA fragments. This method offers several advantages over traditional biopsies. The first being, liquid biopsies are non-invasive. All they require is a simple blood test. Liquid biopsies can also help identify cancer before symptoms even arise, leading to better treatment outcomes. Next, liquid biopsies can track treatment response by measuring changes in tumor DNA levels. This allows physicians to determine whether the treatment is working or they need to change the treatment for this patient. Liquid biopsies also detect specific mutations to help guide targeted, personalized medicine. Finally, liquid biopsies enables testing in any location, overcoming geographical and socioeconomic barriers. Further research into liquid biopsies will help enable relapse surveillance, potentially preventing cancer recurrence before it can even occur. While liquid biopsies holds immense promise, challenges remain in areas such as cost and wider adoption. As research progresses, this technology is expected to play a vital role in cancer care. There are some key questions that we must address before liquid biopsies can take over. First, how will liquid biopsies impact cancer survival rates in the long term? What are the ethical considerations surrounding the use of liquid biopsies? And what are the potential cost implications of widespread liquid biopsies adoption?
So, there you have it, folks. We hope this video was helpful in educating you more about the advances in cancer diagnostics and cancer monitoring. If you or someone you know is navigating cancer treatment or diagnosis right now, consider asking your doctor about what liquid biopsy options you may have available to you. If you find this video helpful, feel free to share it with your friends and physicians to educate them better about these new advances in cancer diagnostics. If you'd like to double check any of our sources, we left them all in the description so you can go read for yourself about the wonderful world of liquid biopsies. Thank you for tuning in.